Hey there folks, welcome to Plan to Protect with Melodie Bissell, the safest podcast on the internet. My name is Joshua Bissell and I'm the producer of this weekly podcast, where we tackle topics around abuse prevention and vulnerable sector protection. Thank you so much for joining us for our series on elder abuse prevention and awareness. Today Melodie is going to be addressing again the subject of elder abuse awareness, looking at the various types of abuse that the vulnerable adults in our lives can suffer and be vulnerable to. Please pass this along to those that you work with and those in your life who are vulnerable to elder abuse. Melodie's going to start off today's podcast with a case study about how you may become aware of elder abuse in your life and in your community. Thank you so much for joining us today for Plan to Protect with Melodie Bissell, the safest podcast on the internet. See you soon.
Thanks, Josh, for that opening. Yes, we are in the second of our series on elder abuse. And during the whole month of June, we are focusing on raising the awareness of elder abuse and providing the tools and the tips and the awareness and the knowledge on how to respond to elder abuse. Last week, we talked about the prevalence of elder abuse. We began with a case study. I have another case study for you today. And today we're going to talk about how to recognize and respond to elder abuse. I received an email that said last year, my elderly neighbor's nephew moved in with her while he was attending university. Since then, she has become very withdrawn and hardly sees anyone anymore. I reach out to her and she doesn't respond. I worry that her nephew is not treating her appropriately. What sort of actions, what kind of steps should I take? How do I know if he is harming his aunt? What is elder abuse? Let's begin once again with this definition of what elder abuse is. Elder abuse is any act or harm done to an older adult. It has been defined as a deliberate action or lack of action that causes harm, injury to an older adult. The harm can be physical, emotional, financial, or sometimes even a combination of any one of those. Neglecting an older adult by not doing something can be just as abusive as actually striking out an older adult physically. Under-medicating, over-medicating can also constitute abuse. Violating the civil rights of an individual, for example, by not allowing them to leave their home or to have visitors, can also constitute elder abuse. Elder abuse is most commonly caused by a family member, a close friend, a relative, or a caregiver. The one thing I want to say to you, if you are a senior, if you are an elderly person, elder abuse is never your fault. Please hear me. Elder abuse is not your fault. It is controlling behavior. Abuse does not stop on its own. If it's ignored, it will continue, and it may even grow worse. You can take action on your own, or you can reach out to others to help you stop the abuse if you are experiencing elder abuse. You may feel like you need to protect your family members, your caregivers. You may feel that it could get worse. You may love your spouse and feel that you want to protect them, even if they're treating you badly. Abusive behavior, it's not healthy. It's not healthy for you, and it is not healthy for the person that is harming you. No one deserves to be hurt, and it is okay to reach out for help. So today what I want to do is I want to go through just a profile of a typical victim of elder abuse, and we're also going to discuss a typical profile of an abuser. Now, please know that it's not limited to this, but often this is the profile of the individual that's being abused as a senior, and also the profile of someone who is the abuser. So the victim, often they're over 75 years old. They're often a female, a widow, or someone who is single. There's often a physical or cognitive impairment. They often are socially isolated. They're dependent on their caregivers, and they have very low self-esteem. The abuser, on the other hand, is often under the age of 30 years old or over the age of 50. They're often a close relative or a caregiver. In many cases, they lived with the abused elderly person. They're often psychologically stressed or depressed or in need of finances. Often you'll find that they are substance abusers. They have a history of substance abuse, and they're struggling financially. There are many things that can precipitate elder abuse. Those can be history of family violence and abuse, marital conflict or discord, inadequate housing. It could be cultural norms and beliefs, poor social network, meaning isolation, ineffective coping patterns, and need of finances. COVID has been a huge contributor to causing elderly people to be abused. In quoting Ann Sclater, most elderly people value autonomy above personal safety and comfort, and would rather have inadequate care with families than the best of institutional care. Let's begin with just reviewing some of the different categories of abuse and how to recognize them. So the definition of physical abuse when it comes to a vulnerable adult is it's any physical force or action that results or could result in injury to an individual or death. Physical abuse is caused by inflicting physical pain upon an elder adult. For example, hitting, punching, slapping, injuring an older adult in a way that would be physical abuse. Administration of poisonous substances or inappropriate use of drugs and medication. Physical abuse also covers behaviors such as sedating a person through over-medication, under-medicating, when drugs are needed for a medical problem. Deliberately exposing a person to severe weather, physically confining the person for long periods of time, whether it be to a chair, a room, a bed, or a house. This would also include overuse of forms of restraints. You would recognize if someone is being physically abused by bruises, welts, broken bones, burns, unexplained bruises, aggressive behavior. Sexual abuse can include any forced sexual activity or inappropriate touch. You'd recognize sexual abuse by pain, bleeding, bruising in the genital area, depression, signs of fear, withdrawal, anxiety, or passivity. Emotional abuse or psychological abuse is making threats to an individual, threats to someone that they love, threats to their pets. It's mental cruelty, intimidating, harassing telephone calls, humiliation, forced socialization, isolation, treating an adult like a child, not allowing the older adult to make decisions for themselves. You would recognize emotional or psychological abuse by an individual showing fear of certain family members, friends, or caregivers, withdrawal, passivity, agitation, apathy, depression, without any apparent reason. It's unexplained paranoia. You may also recognize unusual weight gain or weight loss, reluctance to talk openly, making inconsistent statements, accusations. Maybe they're hesitant to respond to questions that you ask of them. You notice behavioral changes, including avoiding eye contact, low self-esteem, difficulty sleeping or excessive sleep, making excuses for social isolation. This is often hard to detect, but may be an indication of other forms of abuse, such as neglect or physical abuse. Naturally, some of these indicators may be present in older adults that are not being abused. However, they are indicators of abuse. The elderly often fall prey to financial abuse. Financial abuse is a misuse of an older adult's funds and assets without that person's knowledge or their full consent, or in the case of an older adult who is not mentally capable, not in that person's best interest. The elderly may fall victim to scams, which includes theft of money, belongings, credit card, or pension checks. Forcing an older adult to make changes in their power of attorney or their will. It can include forgery of signatures on personal checks or legal documents. It's withholding money that the older person needs. It's forcing, persuading them, or tricking an older adult to sell their home or their possessions or to pay for unnecessary services. Persuasion to invest in fraudulent investment schemes, pressuring an older adult to provide services for free, or abusing someone's power of attorney, guardianship, or trusteeship. You can recognize financial abuse because the individual is confused about their own finances, may have signed a document without being told of the consequences. They have lack of financial choices and decisions. Family members moving in without agreement and not sharing in the costs. Unusual bank or ATM activity on behalf of the older adult. A discrepancy between their income and the standard of living. Possessions are disappearing. Sudden or unexplained difficulty in paying bills. A refusal to spend money without agreement or caregiver. Naturally, some of these indicators may be present and the older adult is not being abused. They may merely be possible indicators of financial abuse. And finally, the last form of abuse is neglect. It's withholding clothes, food, medication, personal care, hygiene, medical care, shelter, leaving an elderly person in an unsafe or isolated location. It's leaving an older adult tied to a bed or a chair. Neglect can be intentional or unintentional. Unintentional neglect can occur when a caregiver does not provide the necessities because of lack of skill, information, or interest. It's also important to distinguish between neglect caused by someone else and self-neglect caused by the older adult themselves, not taking care of him or herself. You can recognize neglect by physical signs of malnourishment, dry lips, pallor, excessive weight gain, excessive weight loss, untidy appearance, inappropriate clothing for the weather, untidy house, shivering, a blue tinge to the skin, low body temperature, which might also indicate hypothermia. It's lack of needed appliances, dentures, hearing aid, mobility aids, or glasses. It's a lack of safety precautions and supervision. It's infrequent bathing or poor hygiene. It's incontinence, physical or mental deterioration with no medical reason, confinement, wandering dangerously, lack of groceries, inadequate or over-medication, lack of safety precautions and supervision, cooking or housekeeping standards that could lead to accidents or illnesses. Naturally, again, some of these indicators may be present and the older adult is not being abused, though they are merely indicators that abuse could be occurring. So many elderly people don't want to report abuse. They may not know about abuse. They've been told they deserve this. They're fearful, very fearful that it could get worse. They don't want to get someone into trouble. I recently read a statistic that said only 1 in 6 cases of abuse is ever reported, compared to 1 in 3 cases of child abuse that's reported. Rather than occurring as an isolated incident, abuse of the elderly is reoccurrent in up to 80% of the cases. If abuse is happening to you, please consider getting help. Please consider reporting the abuse. If you do not report the abuse, it will escalate. You report abuse to stop the abuse, because abuse of an elderly person is a crime. Abuse harms the victim, but it also damages and harms the people committing the abuse and family members. What you should always remember, and I started with this today, is you do not deserve to be abused. You are not to blame for your abuse. You have a right to live without fear. You have the right to a safe, healthy environment and healthy relationships. Abuse often gets worse over time. You have the right to control your life and make your own decisions. You are not alone. Others have experienced abuse, and many have found ways to deal with the abuse of the situations that they face. If you are not yet ready to report abuse, and you may or may not be ready to leave the situation that you're in, it is important for you to know the options that you have, the options that are available to you. To seek help, you should tell someone. Find someone that is safe, that you can tell. Ask others to help you. When you are ready, turn to the police for help if someone is hurting you or if you do not feel safe. Talk with people to learn more about the resources and services available in your community. Today in our show notes, we are going to include some resources and helps for you. Find out your options of care. Find out ways that you can personally care for yourself and provide financial security. Make a safety plan. And I'm going to give you some tips on how to make that safety plan. You may want to consider some of these options. Put in a safe place emergency phone numbers, written out, stored in a safe place. Put aside some emergency money for a taxi, a hotel, or a payphone. Put in a small bag some extra clothing, a list of your medications, phone numbers of your pharmacy and your doctor. I would recommend that you put aside 3 days of medication. Make sure that you have access to your glasses, your hearing aid, and other assistive devices, such as your cane and your walker or your wheelchair. Determine a safe place where you can go, whether that be to a friend's home, to the hospital, somewhere that you know will be safe. Plan out an escape route for your home. Know where your keys for your home are, your car, your safety deposit box. Have copies of relevant documents, your identification, your birth certificate, your marriage certificate, or record of common law relationship, your notice of assessment on your home and your income tax, your checkbook and your credit cards, your lease and rental agreements, your home deed, your bank information and recent bank statements, your health card, your social insurance number, social security number, your passport, and your immigration papers. That can be part of your toolkit when you are ready to get help. Now, what about if it's not you that's being abused, but you believe a friend is being abused? If a friend tells you that they are being abused, we would encourage you to be a friend. Be patient. Listen carefully. Don't jump to conclusions. Believe them. Do not question whether or not they're telling you the truth. And again, don't jump to conclusions. You may be the very first person that they are entrusting this story to. It may be hard to hear what they're saying, especially if the perpetrator is someone that you know or seems like a nice person. Don't judge them. Do not express pity for them or even tell them what to do. Don't tell them what to do. Don't be controlling. That's exactly the behavior that the perpetrator has inflicted on them. Tell them that you care about them and offer them a level of support that you feel comfortable providing. And know that you can provide on an ongoing basis. Do not promise those things if you are unable to or don't feel comfortable doing so. Please know and understand that changing an abusive behavior and relationship is extremely difficult and requires professional counseling. Do not confront the abuser. It can take a very long time for individuals that are abusers to decide to make the change in their lives, to reach out and get that professional counseling, and to be willing to talk about the situation. Don't deny what is going on. If you choose to deny what is going on or not to listen to the person, this will serve to isolate the individual even further. Again, please do not confront the perpetrator yourself. This could cause danger to yourself or even more danger to the person that's been abused. Educate yourself on the resources that are available to you within your community. Learn about safety tips for the elderly. Go to a local community information center. Reach out to your police station or your healthcare providers. There are community supports for this very purpose. Talk to your doctor, your lawyer, or do a search on the internet. Encourage them to seek help. Offer help to them. Find the right place to turn. If the individual does not have cognitive capacity, please call the police. We have covered today how to recognize and respond to elder abuse. Elder abuse is an atrocity that we are facing across our nation. Please be aware of the prevalence of elder abuse, how to recognize elder abuse, and how to respond appropriately to elder abuse. Again, today we are providing in our show notes below some resources and contact information. If you believe that you are being abused or if you know of someone that is being abused. Next week, we're going to cover tips on protecting the elderly. Have a great week, everyone. Bye.